It's time, ladies and gentlemen. I'm calling the meeting of the Regional Advisory Council of the Pikes Peak Council of Governments to order at 10:01, April 23rd, hard to believe, 2026. And I am advised that we have a quorum. That would be me, Debbie, and Scotty's online, right?
Yep, I'm
And
here.
Susie's online, correct?
We also have Gordon Rick and
Yes.
Jennifer Nimmo
Oh,
online
okay.
as well.
Okay,
Correct, I'm here.
thank you. All right, so we have a quorum. Fantastic. One housekeeping comment. That's Clark. It's not Don. Yes.
And I'm Sheila Williams from Park County.
Sorry, I'm sorry. Thank you, Sheila. Okay, one housekeeping item. For purposes of procedure, if you wish to speak, please raise your hand and be recognized before you speak. Appreciate it. Okay, we have an agenda. Do I hear a motion to approve the agenda? Yes, Debbie. Motion to approve? Do I hear a second? Thank you, Sheila.
Second.
All in favor? Aye.
Aye.
Any opposed? Motion carries. Agenda's approved. And we have consent items with one item in the consent items. Any comments on that item or a motion to approve the consent agenda? Yes, Clark.
I'll move to approve, Madam Chair.
Thank you. Do I hear a second?
I'll second.
Thank you, Debbie. All in favor? Aye.
Aye.
Opposed?
Aye.
Motion carries unanimously. Okay, public comments. Do we have anyone that signed up for public comments, Jared? No public comments. Anybody online that wishes to speak? Seeing none, we'll move on to the next item, which is action items. I don't believe there's anything there either. This could be a really good meeting. I'm liking this. Okay, we're into the information items in the presentations, which is primarily why we are here today. Okay, first I want to thank those people that are on the panel. Thank you all. And the format for this will be a 3-minute intro. We'll start on the left. This is my real right. This is my other right. So we'll start on the left and move to the right, give a 3-minute intro, and then we'll go into the panel discussion. Go ahead. Yes.
Sorry, I'm new to this space, so appreciate it. Hi, Desiree James. I'm a director of adult services or adult outpatient services at Diversus Health. And I think just with our intros for 3-minute, just talking about trends that we're seeing with people over age of 60, some barriers and things that are going well, right? Okay, I just want to make sure I'm on track with what we need to do. So some things with Diversus Health, we see strong trends of people over 60 desiring to be social. Addressing mental health issues is now seen as more acceptable, although we still do see some stigma of accessing mental health services for this population. Desires to learn about technology, anxieties related to like health uncertainties, chronic illness, depression in late life. Lots of barriers that we notice with Diversus Health populations in this range are financial concerns, health concerns, challenges with technology, affordability or accessibility for transportation and housing, some isolation and challenges, and then just a lot of themes about loss in life. And then just some things that are working well. So telehealth has been a big advantage for accessing care.
Good to hear.
I don't know if there's additional things that I can add, but I know we've got 3-minute pieces, so.
You'd be surprised how long that is.
I know, I know.
Nice to meet you, by the way.
Thank you. Nice to meet you.
Good morning. My name is Dr. Sherry Gibson. I am a geropsychologist. That means that I'm a clinical psychologist focusing on aging. And I'm also the founder of the Pikes Peak Elder Justice Center here in town. I'm on faculty at UCCS in the psychology department, and I also have a private practice. My role at the Pikes Peak Elder Justice Center is board chair, and the services that we provide are kind of broad, but very focused around elder abuse, mistreatment, and neglect in terms of prevention, intervention, and addressing that at the very personal level, but also at an advocacy level. And the trends that we're seeing. Is that, and this is directly tied to our state demographics. If we look at some of the statistics from our state demographer's office, in which there is huge economic instability and also housing costs, both of which affect older adults very intimately. And one of the things that I think is a manifestation of those two pressures for older adults is a rise in financial online scams and fraudulent activity in the cyberspace. And so we're seeing the real impact of that in older adults' lives, the devastation that that causes to an older adult. And when we think about housing instability and economic instability, what we see is that older adults are looking for that quick fix. They're looking to for the thing that is too good to be true, that comes across on their email, that comes across on a phone call, even mail-in lotteries that are still being used despite how much technology and AI is out there. And so when an older adult is victimized in that way, it has both an economic and personal cost. The older adult can't make up what's been lost. There are depression, certainly all the psychological fallout of that depression, suicidality, but there's also financial destitution, loss of a primary residence, which then still feeds into the housing instability situation, and also just a mistrust in other people. A lot of older adults do not report this type of abuse. And so one of the things that the Elder Justice is doing with the support of a recent award by the National Collaboratory to Address Elder Mistreatment is to develop support groups for older victims of these crimes. We don't have anything that exists in our community for that. And so oftentimes there will be a crime and there might be a report to the FBI or to law enforcement, but nobody ever really provides the support to the older adult who has gone through this terrible thing. And so we are developing those interventions right now. And this is a one-year project, and we've also applied for some grant money to also help fund that project. So thank you for letting us hear that piece.
Well, thank you for the invitation to be here. My name is Jason DeBueno. I'm a social worker at Silver Key and one of the people who very much cares about this particular work. I've worked at Diversis in the past, and certainly along many of the people on the panel here, all working to be able to address the behavioral health needs of older adults in our community. I'm really excited to share that this community has experienced a 16% drop in suicide rate, according to the recent report by the coroner. The challenge is that while that's exciting in terms of saving lives, what is disheartening is that in the older adult category, we actually have trended up during that time. So it's been a significant increase over the many years. And while there's not recent data related to this, I did hand out to the people that are in the audience here, and we certainly can get this to those that are online. But one of the challenges is that, at least in El Paso County compared to Colorado, in 23 data, which is the most recent data set, El Paso County ranks higher than Colorado for death by suicide for individuals over the age of 65. And so one of the major contributing factors to that is the method and also the social reasons why people choose to move forward with taking their lives. And isolation and loneliness is the key part of that, as we were just describing. And many of the great things about the Pikes Peak region is this is a wonderful place for people to retire from the military. Oftentimes, individuals who retire from the military are those folks that are saying that have access to lethal means. And that is one of the reasons why that we see with the higher rate of suicidality with older adults in this community is access to lethal means. And I would venture to guess that we're actually underreporting the level of suicidality in those that are 65, 75, 85, 90 years old, because I think there's another contributing factor that's a little bit of an unknown issue, and that's regarding the way medications are managed. I think that there is something that's happened in our community is that stockpiling of medications is frequently what occurs in our community. And I think older adults, particularly because of the amount of pain medications that are prescribed, oftentimes individuals will stockpile until they've had enough. And then it gets ruled an accident that they somehow didn't manage their medications well or didn't know how to manage their medications. That's me speculating, but I will tell you that over and over again, I've heard individuals that have been part of the treatment that we have available or other systems, and we hear that they've died by accidental misuse of medications. When I wonder, is that truly the way that they died, or was this an intentionality due to the pain management, the emotional pain that can happen with isolation and loneliness, and the fact that people are not socially connected to the degree that we would hope? The other issue I will share with you is that while we know that some of the major contributing factors are depression and substance misuse that can happen, frequently this community doesn't recognize that those in the older age group are often struggling with the idea of introducing alcohol and other things to their lives that has been a little bit vacant and may have been part of for some time. But alcoholism in older adults is a very significant issue, and it's a growing issue. It's an easy way to be able to numb the pain of isolation and loneliness. Silver Key exists to be able to build relationships among people, whether it's through our Meals on Wheels designation or the transportation that we provide to the healthcare system or our activity centers. And it's one small way to be able to help address this bigger issue, but it is a community. I think I'll use the word contagion. And I think that the partnerships of the panel here and the fact that we have the volunteers from the RAC that give of your time to be able to improve the community's access to care is an important next step. But I also think it's important for us to be vocal about what the challenges are and make sure we're vocalizing that loud and with a repeat message until the whole community recognizes that it's not just about the children and young adults that were dying by suicide. It is our older adult population as well. Thank you.
Morning, everyone. I'm Emily Brady with the National Alliance of Mental Illness here in Colorado Springs. We are part of a national organization. We're the largest grassroots organization for mental health. And all that we do is from that peer perspective. So we walk alongside individuals living with mental health conditions, alongside their family members and care partners that are supporting their loved ones. Everything we do as far as our support programs, our educational classes, and offering conversations around mental health is always at no cost. So if folks are just needing a safe space to be able to talk openly about what they're experiencing, that's really at the core of how we show up here in our local community. I think in the conversations of older adults, we are experiencing the realities of the uncertainty of what's taking place with the federal government and the concerns about potential cuts around support from that mental health perspective and also housing. So I think a lot of our conversations, especially with our family caregivers and care partners, is centered around I'm taking care of my adult loved one with severe mental illness and also supporting my parents that are older adults. And so how do I navigate this space of stressors around caring for all the individuals that are around us that are struggling and trying to figure out what is this going to look like when there's possibilities of services being impacted. So having those frank conversations around caregiver burnout, having frank conversations around taking care of our own mental health as caregivers and care partners. So often when we're in that space, we forget about taking care of us. So what does that look like for us to be able to elevate those conversations and lean into, frankly, there is a lot of uncertainty and there is a lot that we don't understand. And so how can we focus in on what we can gather, what is the information that we can make sense of in this moment, and plan as best as possible in the near future and the years to come to make sure that you as an individual are taken care of and those that you're also supporting are taken care of as well. So I think that's just the realities of some of our conversations that we are experiencing and just continuing to offer that support of what's available as far as mental health support. So that's what I sort of bring to this conversation. And again, I'm grateful for being able to have a conversation and have a touch point of what's taking place for all that's going on in our community because there's a lot going on. Thank you.
Thank you.
Good morning. My name is Kelly Peter Schmidt, and I'm the director of the PEARLS program of Colorado. PEARLS stands for the Program to Encourage Active Rewarding Lives for Seniors. This is a program that's out of the University of Washington, has been around since the 1990s, so it's well proven system, and it's been here in El Paso and Teller County since 2020. So we really focus in on minor depression, anxiety, and loneliness with those that are 60 plus. And thanks to the Area Agency on Aging, these are fully grant funded services, so they're no cost services to our participants. So we have coaches that have gone through the University of Washington training program, and they go into the home and help those older adults with those issues, minor depression, anxiety, and loneliness. So we come up with goals and a path forward to meeting those goals. So it's about a 6-month program that we work with these individuals, and our coaches see them 6 to 8 times throughout that 6-month period, just to initially set things up with them, get to know them. As you can imagine, for each individual person, it's very different. And so we really focus on 3 pillars. We're looking at more movement, more socialization, and doing joyful activities. So our coaches are going to go into the home and find out what that means for each person, and then come up with some goals and a plan to meet those goals. So really trying to work with them to get over those transportation barriers, introduce them to ways to get that more socialization, whether it's our senior centers or, the lunches with Silver Key. Really, we have a nice set of resources that we can bring to them. And because I feel like a lot of our older adults don't realize how many resources are out there. We have, I feel like in El Paso County, we have a lot of senior resources. And we just need to bring those to our folks that are in home, especially those that are isolated at home. So, yeah, we serve El Paso and Teller County. We haven't had a Teller County coach for a while, so we're kind of we've got a coach for them now, so we're trying to re-engage with Teller County and just help as much as we can. So I feel like with our services, we're kind of overcoming 2 barriers. We go into the home, so we kind of take the transportation piece out of it. And then also what we're seeing is referrals can come from anywhere for the PEARLS program. It doesn't matter. The only really eligibility requirement is that they have to be 60 years or older. So it doesn't matter what kind of insurance they have. And we can go into the home, and what we're seeing is that referrals come to us. And then when we contact that individual to set services up for them, they decline services. So I think, especially with this older generation, there's kind of a level of denial, and really mental health is something that they don't want to talk about. And so I'm hoping that by, coming into the home, we can remove kind of some of that stigma of having to walk into an office space or that sort of thing. And we're definitely not in place of therapies and counseling. Those are all very important. So we can be an add-on to that, or just for somebody who might be more in the blues and not seeking formal therapy, that we can go in and help those services. Thank you.
Thank you.
Good morning. My name is Chris Griffith. I am a PhD student at UCCS with the UCCS Aging Center, where I've been a trainee for the past several years. And so we really offer a comprehensive range of both services and our missions in our program and in our clinic. So in our mission, we are, of course, meeting the behavioral health needs of older adults and their families in the community, but we're also training the next generations of geropsychologists, so psychologists who really specialize in aging-related issues. But within our services, to do that, we have graduate student clinicians who provide individual psychotherapy for, a wide range of issues and problems like depression, anxiety, stress, adjustment to medical issues. Caregiver stress is a big one in our in our clinic, but we also provide assessment services, so cognitive evaluations, neuropsychological evaluations, because there are so many older adults in our community who are concerned about their cognitive functioning, or their families are concerned, and we're able to provide some sort of clarity around what might be causing that concern, whether it is dementia or medical issues or medications, or potentially it's a mental health issue that's being misattributed to cognitive concerns. And then something else that I think is really unique that has been growing over the past few years in this clinic is our range of group-based services. So we have various skills groups, whether that's mindfulness or cognitive skills training. And then we have groups specifically for caregivers in the community who either just want to know more about how to be a better caregiver, or they're just seeking that peer support and connection with others who understand what they're going through. And so what I really appreciate about our clinic is this dual focus on not just older adults in the community, but also their caregivers and their families, knowing that a lot of the age-related challenges that we see, whether that is cognitive concerns or functional changes or chronic illness, that's not just affecting an individual, but also the broader family system, or at least the direct caregiver who's taking care of that person. And in addition, we've also added a new role with a few years ago, a cognitive care advocate who is almost like a case manager. So someone who frequently checks in with our clients about how they're navigating certain healthcare systems, or how they're doing accessing resources. Because usually in working with our clients, we're always letting them know about a lot of the different resources, as you mentioned, that are available in the community that they don't always know about. We're trying our best to make sure that they get connected with those, so that they're not only relying on us, because there's only so much that we can do as mental health providers. But yes, thank you so much for having me. Look forward to being here.
Thank you. Wow. I'm impressed. Um, we had two subjects to discuss as a panel. One is, what are the barriers for accomplishing some of the objectives you just outlined? And oh my gosh, I think I heard a lot of barriers. And the second thing is, what's working well? So who would like to start off with barriers? That's the easy one, as far as I'm concerned. Yes, thank you.
Yeah, I think all of us kind of mentioned a little bit in the introduction, but I would say transportation, there's stigma associated with mental health, cost. There's, I feel like, less and less um, payment systems that are paying for mental health care and that sort of things. Those are some of the barriers I see.
Could add on to that as far as transportation being a barrier for accessibility, but also seeing that even if older adults are able to access transportation through other resources, that the transportation isn't always available for things like social activities, which increases the isolation and loneliness, where they might get transportation for medical care or mental health services, but just transportation for those social activities can increase the isolation and loneliness.
I would like to add on to the piece about transportation, specifically with caregivers, is maybe they have access to transportation, but they don't have the time because they are so busy providing care for their loved ones, and potentially, caring for their own children or working a full-time job. And so we do hear from a lot of folks about a need for like telehealth services. We do that for individuals, but we're always having a debate in our clinic about telehealth groups for caregivers. We haven't done that yet, but it's definitely been something on our mind, and something we know that a lot of caregivers in the community would benefit from.
I also was going to say prioritizing needs and recognizing the importance of making sure that your mental health, physical health are well maintained. I think another piece we talked about resources, and while I think we have an understanding of the resources, or at least the key players in the community, how do I actually access it? And at what point do I actually need to begin navigating that support? Instead of getting into that crisis perspective, how can we be upstream and be preventative and be able to get folks connected sooner rather than later?
I think one of the resource challenges that we have in the community is just the capacity for the workforce. The capacity both in primary care and in the behavioral health world is very limited, and there's not a lot of incentive to be in the workforce related to gero psych and gero care, is because much of that support comes from Medicare. And Medicare continues to be such a very difficult funding stream for practitioners to be able to make that end meet. And so what that means is there's a lot of demand and not enough capacity in the workforce.
Okay, so what's working well?
Well, I'd like to tackle that one.
Good, thank you.
I think there is, and others have alluded to this, that we have a very, in fact, we are such a unicorn in El Paso County. When you look across other cities or mid-sized cities across the country, we have such a concentration of mental health professionals focusing in geriatrics in this community. And one of the reasons why that is that we have a university that has, there's only five or six universities across the country that do a PhD in geropsychology. We are one of them. And the reason that I think we do some things very well here is because we have that academic presence that not only lends itself to training future geropsychologists, and not just geropsychologists, but people in nursing, people in social work. That we have that presence here, that we're doing research, but we're also training people in the field. I will also say that we have incredible relationships. I've been in this community for over 25 years, and the relationships that we have across services are very tight knit and very collaborative. There was always a concern, and there's been a concern across the country that most services in most cities are extremely siloed and are not speaking to one another, and therefore people are not getting coordinated care, and they're not getting effective and efficient care. And I will say that even though we have still those barriers that we all work with across our own disciplines and agencies, we are doing it much better than most communities. And it's because we trust the relationships. Many of us who have been in this space have stayed in the space, and we've stayed in the community, which has allowed us to build trust and connection with one another. And when we have a need, we can pick up the phone and still call somebody, and they will answer the call. And I am just inspired every single day by those relationships and that connection. And I know that, in fact, I've had conversations with Kelly this week. We're coordinating care with a Silver Key client and trying to make sure that this person gets access into a home where she's changed her phone number, hasn't been accessible to a lot of service providers. And it's because we have this relationship that we can coordinate this together, even with our students like Chris. Chris worked with me for a year in a rotation at the Justice Center, and our students are out there in the community doing the work. And so this is all just, to me, it's very inspiring. And I know because of my work across the country that we're doing it really well here. And we should be proud of that. For all the barriers that exist, we have something really uniquely effective.
I think just to piggyback on just this unicorn that we have in our community, I'm really proud of how we are creative and strategic in how we show up together. I think it's one thing for us to be collaborative, but I also think we've taken the time to be able to look at what can we do differently to make sure that we're reaching the older adult population. And so leaning into intergenerational activities and making sure that we have opportunities to bring the family together and not just focus on older adults as a way to be preventative. So I think just that ongoing creativity and making spaces for all is a success for our community.
Completely shameless plug. Thanks, Emily. The Senior Summit for Silver Key is happening May 14th and 15th, and we have an intergenerational program on that Friday. We'd love to see you all there. But actually, I was going to build on something else that is a resource that we're tapping into related to the workforce. While that was a bummer to say what the challenge is, there is an opportunity that we're exploring, and it's working alongside the pharmacists in our community. They're kind of a limited amount of access in some ways, not because they're not available, it's because we don't necessarily think of them as part of that care team. So being able to activate the pharmacist has been really important for some of those individuals, not only to be able to be aware of the medication stockpile, but helping individuals sort out what are the medications that they should be taking and how should they be taking them, because many are prescribed by many different providers as well. And when you do this hodgepodge of intervention, sometimes that's counterproductive in the whole treatment. So we are activating our pharmacists differently now as part of our support to be able to address, again, that either the suicide piece or the medication mismanagement. And I think it's a great untapped or minimally tapped resource in our community for the pharmacists in the community.
And I'm just going to kind of tag on to what you guys have said because I agree with what you're saying. I feel like our community, there's another organization called the Senior Resource Council. And between that and the AAA, I think it's really bringing us together because I feel like there's a lot of overlap in what we do in our different organizations. But there's always those particular clients that don't quite fit into your model. And so it's really nice to have this community around us to be able to lean on and refer to. And one of the nice things about the Pearls program is we have Dr. Rachel Thayer from the UCSS Aging Center is one of our supervisors, and then we also have a psych nurse practitioner that's down in Pueblo that they are our advisors for our coaches. And our psych NP, she can go over that medication list like you're talking about, just because the time you get to 70, 80, 90 years old, you probably have 10 doctors and 3 different pharmacies, and they're not talking to each other. And so it's so nice to be able to bring that one med list together. We can have somebody look at it and say, this person's on 3 different antidepressants, but we don't prescribe, but we say, let's have them go talk to their primary doc and just see if maybe we can, get rid of those. So anyway, it's really a nice way to look at those, like what you're saying, and just evaluate and put their best foot forward.
Really don't have too much to add there, just that I want to echo everything that has been said about I think the communication and collaboration between various agencies. I say that from personal experience, just having not just been at this UCCS Aging Center, but also at the Justice Center with Dr. Gibson and at PACE. So getting to see all types or ranges of older adults in the community who and where what organization or agency they might benefit from the most, and trying to help them coordinate that and connect with the service or the agency that's really going to serve them. And so I'm really glad to be in a community where there are those options.
Thank you.
Laura, if I can make a comment.
Debbie, please.
I live in a 55 plus community, and a lot of the people in the community know that I volunteer at an area agency. And so I'm kind of the go-to person in the community when people want to know about what's going on. I had a neighbor who has deteriorated a lot physically, and he can't drive anymore. He wanted to know where he could get transportation. So some other neighbors that are more friendly with him than I am mentioned, oh, you have to talk to Debbie. She'll be able to tell you all that stuff, which I did. And I gave him our yellow book and I gave him some other things. And they're now getting meals and transportation from Silver Key. But I think the issue is, how do we, people are afraid to call, even though I tell people all the time, call the area agency, they'll be able to get the information. I think if we had more specific people in the community, like I am in my specific community, that could be offering that assistance. And I worked at an area agency for 9 years. So I know all of that stuff, but I think if we had more of those advocates, specific advocates in the community helping, that would be really good as well. So
Talking about that during Volunteer Appreciation Week. Yeah. And anybody else on the rack or online that has a specific question or comment? Yes, Sheila.
I live in a very rural area in an hour and a half from here. Uh, Many times our isolation is on purpose. Some of our individuals who move to the mountains want to be left alone, but they don't realize the services that they can get from people who are in the metropolitan area. I think telehealth would help very much, and especially caregivers to be able to identify those individuals who are in need, who may not know that they're in need, or maybe they just need to talk to someone of their own age group. But we have very few groups up there. We have churches that are up there, but Park County is pretty large and diverse, not only geographically, but also demographically. We do have a large number of seniors that are living in rural areas, but the transportation is the issue. So telehealth would probably be the key if we can teach people how to use these things, and also to stay away from scams, which once somebody gets your number and sells it to people in Cambodia or wherever, they're going to scam you for everything they can. And it is a very dangerous concern because people in my age group have stored up a little money because they're afraid of what's going to happen, and somebody out there wants to get it from you. So I appreciate all of the comments that were made, and even though you can't come up to us, we might be able to get a group to come down, at least as far as Woodland Park, to Teller County to get some of these services. Thank you.
Sheila, do you have any suggestion about uh, how the information could be given to people? I'm an advocate for education, and I think we lack that on many different levels, many different subjects. What would be the best way to let people know that these things are available, and maybe the telehealth situation as well?
Well, that's a good question because communication is the key problem in the rural areas. It's just like our county newspaper gets to us a week after things have happened. So unfortunately, don't depend on the county newspaper to get things out. I think churches, I think libraries, if we could have even a set up time in each community where, hey, come in and talk to us at the library. Most of the communities have libraries. Hartselle has a volunteer library. It's not with the Park County system. So that would be one suggestion. And I think the churches and the libraries, maybe even the schools, although there are grandparents that are raising their grandchildren, so they might have communication through the schools, but there are very few organized ways to get communication out. As you have gone up Highway 24, you've seen the signs, fire stage 2, firebrand, all that sort of stuff. We still have people who don't read those signs, unfortunately, but that might be one way to get things out is put up a Burma shaved sign and say, come to the meeting. I don't know.
That's not a bad idea.
If we can get permission to put up the signs, it might be something because
There you go, Jason.
Yeah, I just wanted to share that the telehealth support is something that I think makes a lot of sense. And then there's something else that's a little bit more telehealth light. And so we do calls of reassurance is what intervention we have, and it's a low barrier access. So it's not going through a full evaluation for behavioral health needs. It's really more just calls of reassurance. Somebody wants on a regular basis somebody to call them. So we do in the past have had some customers from Denver. We've had some customers in different parts of Colorado. So it's not an impossible thing to bring. The challenge is that I will say that the opportunity is to be able to bring that. The challenge is to be able to activate when somebody doesn't answer. So in this community, this year alone, we've saved 3 lives by the fact that they had a scheduled caller to be able to call them and they didn't pick up. So they didn't pick up. So what we did is we activated our resource navigators to go out and visit the home, and they were hearing pounding on the wall, at least for one individual who had fallen off the toilet and had no access to be able to get to their phone to make the call for emergency response. So this is an example of where on the behavioral health side, it was addressing from I care about you enough to call you daily and have a little bit of a conversation, but then also I care enough about you that if you don't call, we're going to activate. And that's been one of the challenges. Going back to Debbie, what you were saying is that if you have somebody locally, that if we did calls of reassurance in the rural areas, that if somebody doesn't pick up on their scheduled day, that we have somebody that we can say, you know, Debbie, can you go out and visit just to see if they're okay? That would be something that I think would be a very important, very low barrier, very resource light project, and yet still be able to get a meaningful support until telehealth may be needed for some that have more acute behavioral health needs. So something to consider that we might be able to explore a little bit down the road.
Thank
To
you.
add as well,
Down the road with all the different signs. Getting you there.
to add in addition at the end, the end of the sign. I was just wanting to add some pieces around the telehealth accessibility for care. I mean, with Diversus Health and our core services, counseling, psychiatry, addiction services, and crisis, but even having rural providers who are both on site in both Bailey, Fairplay, and Woodland Park, but then also accessing telehealth spaces, and that our provider out there in Bailey and Fairplay lives in Bailey, and so she understands the community, the pieces there. And I think that that's a really important piece for rural communities, for older adults. I'm meeting with somebody that understands, just the nature of being in the rural places, but then also accessing mental health support. And that's things that I wanted to add that are going well is our access to telehealth services. And even with Diversus Health, right, that goes from intake all the way through to all of our core services. So in our intake process is same day access. So the day that you're ready to connect and get some support is the day that you can connect, and even connect telehealth if there's a barrier for that, or if that's a preference, but for the rural places especially.
Can I ask you a question about that? Now, is this the Diversus? Is Diversus and Sol Vista the same, or these are two different?
Different.
Okay, because I wasn't sure if Sol Vista was in that area as well.
Sure.
And I was just bringing that up, Sheila, because I'm from Buena Vista, Buny, if you're a native, and BV, Buny. And so I travel through your area quite frequently. And I know that we were, Melissa Martz here at the Area Agency on Aging, she and I were planning to do some just education in Park County, and somehow it got canceled. But we would be very interested in at least doing some education series, even if it's about letting people know what the resources are that they can access. For example, my colleagues can't all go up to Park County. I understand that, but we, through the Justice Center, part of our Department of Justice grant is to do rural outreach and education. So we would be very happy to at least come there, give some education about what is available to people, talk about mental health concerns, cognitive concerns, and at least be a way to provide that. And we'd be happy to do that. So I will give you my card, and please feel free, and that, or maybe we can coordinate some kind of senior day in your community. I think that was something that we were trying to do around World Elder Abuse Awareness Day. And for whatever reason, it fell through, and I'm not sure what that was, but we'd be happy to do that.
I took that as an action item.
That is an action.
Yes, what's your name again? Clark.
Today it's Clark. Yeah, I'm Clark Becker, and one comment and then a question. So get out your crystal ball here when I get to my question. But everybody's kind of mentioned it. But coming from Teller County, we lived up there for 36 years, and there's amazing resources. If you don't feel like you're already connected, I mean, the Aspen 9 Center Community Caring, Cripple Creek Community Partnership in Woodland Park, Teller Senior Coalition, Help the Needy, I could go on and on. amazing collaboration across the county. So if you're not connected, I can help you with that. My question is, I love the thoughts about telehealth and everything, but I mentioned our demographer, my friend Elizabeth Garner, a previous demographer for 25 plus years. She's been saying we're not having enough kiddos, to use her words. And so we're an aging population and we're not having enough young people, which creates a challenge for those services that our seniors need. Add to the fact that AI scares the hell out of most people, regardless of your age, parents, of course. but as far as adults, even to the fact that my wife just needed to reschedule a dental appointment yesterday, and they required her to go on a portal. She's legally blind. Now you wouldn't know it if she were sitting here, but she is. And she, on her phone, a pain in the butt. So telehealth is wonderful, but it's got limitations. So looking forward to how fast technology is changing, what do you see going forward in your respective areas relative to how I would imagine, particularly not 60 years old maybe, but you're 70-year-olds, you're 75, 80. Technology is a scary thing. You mentioned the scams. So any thoughts as how we can help them become more comfortable with that and accessible to it? That's just looking forward. And if your crystal ball works well, I'd love to borrow it.
So, so one of the things that we had received was a grant from, thank you. We had received a grant from the Colorado Department of Innovation and Technology to establish what was called a digital hub. And what it's intended to do is build the capacity of older adults to be able to understand how to use their phone safely, how to be able to connect safely. So we have that. It's local here in this community, and we have not figured out how to necessarily scale it out. The trainings actually come out from New York, though, from Senior Planet. So my guess is that as we build more rapport with them, they may be able to have some other solutions to bring to other parts of the community. I will tell you that going back to the workforce issue, I do think that we're going to struggle, as you were saying, is that there's not a whole lot of interest of moving into the older adult caring system. So just I'm kind of pleased to announce that we had gone into partnership with JAWS out of UCCS, and we are hosting now 2 youth, both are juniors in high school at our organization, and they mentor with 2 older adults that are also learning about what does it mean to be in the activity centers because of the isolation loneliness, and also to be able to have a deeper understanding about what would it be if I went into the field of healthcare related to older adults. Because I think that if we don't get a lot of interest with what youth are remaining as the demographic grows, we will also miss that caregiver opportunity going forward. So I think wherever communities can identify ways to bring youth into experience working alongside older adults, that positions for a workforce down the road. Because if we don't do it now, we will have a whole lot of people who have a lot of need and no caregiver support available.
I think we are missing a huge piece of education. I think it was last week the AAA partnered with ENT, which is going to be Wings, to give a education piece around financial fraud, scams, online cyber violence, that kind of thing. And when I attended it, and I counted 3 older adults sitting here. And I thought to myself, this is a shame because these are the people who need to be at that training. The majority of the people who were in the audience were professionals, which is great. But, I think we are really missing something. We are not getting older adults at the table. We're not getting older adults interested to attend. I mean, we're grateful for Silver Key and the aging expo and other things that kind of draw in older adults, but I just think we're missing something here. We've got to educate people. We have to have, as you mentioned, we need to have peer advocates in the community so that people will speak out. AARP Elder Watch released a survey from 2024, and some of the questions on that survey was asking older adults how concerned and anxious are they about technology and about having their identity stolen. And they're incredibly anxious about it. How anxious are people or worried about the use of AI? A lot of worry. So if we know that information, we really need to do a better job of educating people One of the things that the Justice Center did last year with Silver Key, the Meals on Wheels program, was to we partnered with Elder Watch, and we had flyers with the latest trends in online fraud, and we put those flyers on every person's meal tray that received Meals on Wheels, because we know that people who are receiving Meals on Wheels are part of the demographic of older adults who are more isolated or who have lack of access to care. So I think we need to be so much more aggressive in our education and awareness, and also giving people tools about what to do, where to report it, who to report it to. These are all things that we're just not reaching people.
I agree with that. And the other thing I think we need to do a little bit differently is to educate where AI does have a positive impact into the community. Because I do think there are some examples. One example I will tell you related to transportation that we've all talked about. At Silver Key, and in Vida and Fountain Valley Senior Services, one of the things that we did in partnership together is we brought in the system for us to be able to manage the transportation links through our community. And what happened with that is that this is a system that's AI informed, meaning that it changes in the moment of when there's construction going down Academy, which we know that's not a big bet, but we know that there's always different things happening. So what it does is it recasts in the moment for the driver to be able to better utilize to get that individual to the ride. So what happened is that in the first 2 months of implementation, we expanded by the partnership of the three, expanded 220 more rides for individuals to see. And I think those are the type of things that we can bring forward a little bit differently about. AI is scary, yes, and we have to have the protections, of course, but there are some strategies that really can help us be able to be more efficient and effective in delivery of service. One of the things that Silver Key is doing right now is we're in partnership with an organization called Memory Lane Games Pro out of the Isle of Man. And what this is that it's a gaming mechanism to be able to help people with memory loss to continue to keep their mind as active as possible. And that's, there's other things like that. But what's really cool about this is that we're moving forward in a beta test with an AI system. And what this particular support does is it gauges the individual with memory loss in terms of conversation. And so what it does is it picks up on different ways that people enunciate, different ways that they show exuberance or energy around a conversation. So, for instance, if an individual with major mental capacity or cognitive loss is given an example about how much they loved fishing with their grandfather, but they weren't necessarily able to fully articulate that sentence, with this AI structure, what it does is it takes the emotionality of what this individual is trying to articulate, and it starts to bring forward all of the story, and it helps to be able to have that individual populate story. And then what we do is we work with the caregivers to be able to bring different photos alongside that. And so we imagine creating, it gives me chills thinking about creating storybooks with somebody with memory impairment, with the family being part of that. And we're doing that through an AI support system so that we can tap into what remains and the honoring of the legacy as much as possible with as much integrity as possible, because it's driven by the family. The gift of being able to connection does not need to stop when somebody has memory loss. It's a matter about us being creative in the way, like Emily said, we have to be creative and solution differently. And so this is an example where AI is going to help us activate different people with memory loss.
Yes, go.
I would just like to say that I think just the public involvement with older adults, I think, is really key, because technology and AI is not going away. And so if we allow our older adults to ignore it, and you're going to come across the problem that your wife had, and that having to go to a portal. And so the other organization that I run, Porchlight Friends, we're a volunteer organization, and I know Jason knows all about the volunteers that want to engage. There's a lot of people in our communities that want to engage with older adults. And I think just coming up with public spaces or having volunteers go into the homes of older adults to help them learn how to do that technology, because technology has gotten very user friendly if you're given the opportunity, and it needs to be like on a recurring basis. You can't go in one time and teach an older adult how to do the technology, but if you meet on a weekly basis and teach them how to do that, they can pick up on that. So I think it's just really key to try to maybe get some of those intergenerational communications between the younger people and the older people, and just really try to teach our older population this technology, because you have to, it's not going away. Yeah, exactly. Yeah.
And an unabashed accolade for Monument, our senior center has a volunteer from the town of Monument, from the staff at Monument, who comes in once a week, and he loves dealing with the 80-year-olds. And that does make a difference. So volunteer, yes, he's volunteering, but he's at the senior center, and there you have it.
And we have that partnership also up there with Monumental Impact. And so we have, as an example, I believe she's 86 years old. She was a graphic art, not a graphic artist. She was an artist that would paint, and she would paint these beautiful flowers. And I saw some of the art that she would create. And she said that I can no longer feel like my art stands out anymore. I need to learn differently about how to be able to have creative expression so that it's engaged differently. So Monumental Impact with the kiddos and her, they partner together. And now what they're doing is they're using 3D printing to create the flowers that she creates through art, and creating actually 3D art from that. And that's a great story, but it's about kiddos working with older adults differently to be able to engage the technology. And this is actually happening in the activity center up north in Monument as well.
I just want to add kind of some insight that I've noticed, and it just being in my program amongst my peers. Almost all of us, I want to say all of us, have shared at least kind of some experience we've had where we didn't realize we would like working with older adults so much until we had whatever our first opportunity or experience was. And for all of us in this program that's specifically focused on aging, that has led to this lifetime professional commitment to serving older adults. And I'm also seeing this now somewhat that I'm teaching an aging course at UCCS, and I give students this project where they get to kind of choose their own adventure. And for some of them, they go out and interview an older adult in the community. And I love hearing those students talk about their experience, because they learn so much that they wouldn't have otherwise, getting to see some experience that's outside their own family. And so I really think a lot of what will maybe not solve, but help a lot of some of the concerns that are being raised is just letting younger folks have opportunities to work with older adults, and making sure that they're aware of all those opportunities and encouraging them, because I think many of them would be so surprised to see how meaningful that work is.
Stereotype isn't just an age thing, young, old. Oh yeah, that's super. Anyone else? Anybody online that has a question or a comment? Any no hands? Eric, do you see any? Okay. Any final comments? Okay, thank you all. This has been fabulous. Yes, I agree, Sheila. All right, well, we're moving right along. Jurisdictional update to member governments. I believe that's Jared.
If it is, I don't have any update.
Perfect.
Sorry about that.
No, that's okay. Membership subcommittee. Who's on that? I don't think there's an update there anyway.
Laura, I think that had to do with the people who are appointed to the area agency getting together regarding their presentations back, if I remember from one of our monthly things. But I think Melissa would have had some stuff, but
Yeah,
she's
we'll
not here
just
today.
we'll pass that one up. SRS. Any update there? I don't think there is.
Not
The
really. We've been
technical
working on,
review subcommittee has not met.
Right.
Madam Chair, if I can, Jen Nemo did unmute. I think she was ready to talk, but I don't know if.
I'm sorry?
Okay. Jen Nemo was ready to talk. She's unmuted herself.
Oh, okay. Jen,
yeah,
please.
we've been working on restructuring the grid and are preparing to start working on the next 4-year strategic plan. So there will be dates coming out for the next SRS meeting. So I stay tuned for that, for coordinating that with Melissa, but that process is now beginning. So that's the update.
Thank you, Jen.
You're welcome.
18. Okay, TRS, I believe, has not met since the last time. Jody is not here. Jared, do we have any update from anybody? Melissa, Jody?
I wouldn't say any update. I will say that board did approve the recommendations from the TRS and the RAC from last month regarding the provider amounts that were done
The funding.
for funding. I know that that is in progress in terms of just getting all those contracts prepped. That was probably the biggest news from the board meeting last.
Okay. G is done. The chair has no additional reports at this time.
Oh,
Have it, sir?
Sorry to interrupt.
Yes.
But I was just talking about F. G is legislative update, and I'm happy to go into detail on that if the RAC is interested.
Okay.
Okay. So, I've just got this summary that is in your packet. A few updates from when I drafted this 3 days ago. House Bill 261110, this is vulnerable adult financial exploitation banking. This is the bill that would allow bank employees to be able to hold a transaction that they feel may be fraudulent or potentially fraudulent. The scenario is usually someone comes up to the teller and says, I need to empty out my account or transfer $50,000 to some overseas location. They are visibly frazzled, distressed. Right now, a bank employee, while they may be able to hold it, would be liable in case that wasn't a viable transaction. So this provides a bank employee to pause the transaction, make sure that they fully understand what is play here. So that has passed the Senate. The House did concur, so that is awaiting the governor's signature. In addition to House Bill 261107, healthcare and regulated facilities. This is the one that put a dementia criteria for any facility that wants to say that they are dementia friendly. House Bill 1010, this is adult support and representation in the workforce. It was scheduled to be in committee today. It is now scheduled in committee next week. Just kind of as we get down to the last 20 days of session, things are going to be moving incredibly quickly. The long bill is in the final stages, but the appropriations process pending the long bill has started to break. So a lot of things were kind of bottlenecked at the appropriations committee. Now that they have good guidance on what the long bill will look like, the appropriations dam is kind of has kind of broken, and now you're starting to see a lot of action on both chambers on that. Talking about the state budget and the long bill, the biggest news for us is good news. The senior homestead tax exemption remained fully funded, which was great news. And the state fund for senior services, it's interesting to say that flat funding is good news, but in this budget climate, we're very excited to actually have gotten flat funding. Just based on some of the other cuts that they've had to make, especially in healthcare policy and financing. So we're excited for that. That's kind of the biggest pieces of the state budget for the Regional Advisory Committee. There are, with 20 days left in the session, they're going to have to start identifying which bills are going to make it to the floor and which ones aren't. State law does require any bill that's introduced to at least have one hearing. That's the committee level hearings. But once it gets past that, there's no requirement that it has to be heard on the floor. And so you're going to see the majority leaders in both parties, they set the calendar. They're going to be having to make some tough decisions on how they prioritize which bills make it to the floor. We're still waiting on several big bills to kind of drop. One of them is the sale of Pinnacle. We're hearing that the House Speaker is kind of drafting that one. We're still kind of see that there was not, I would say the appetite to sell Pinnacle has been muted among the General Assembly. And so it's interesting that the speaker is kind of running a bill on this particular topic. They've got to figure out artificial intelligence. That's a big bill. They've tried to do this now for a couple of sessions, including special sessions, and have not found a resolution to this. Corrections, the Department of Corrections has become a major discussion point at the Capitol, particularly around bed space. And then data centers. There's a couple competing bills regarding data centers in the state legislature that haven't really moved. And there was an interesting story that I read yesterday that came out of Space Symposium that the Space Force bases, Buckley, Peterson, Schriever, need data centers. And so the concern is that if the laws regarding data centers could be too restrictive, does that impact mission capability at some of those Space Force bases? And then one bill that was filed yesterday on government liability, Senate Bill 176, is one that someone in my position is looking very closely at. The target is federal employees. However, the way it's written, any government employee, including libraries, professors, basically, if you work in anything that is government supported in terms of, you know, those public institutions, special districts, there is concern, does this also apply to contractors? The wording is such that it could be incredibly expansive. And so that's one that I'm trying to dive into and learn a little bit more. But at one, I list all those topics because those are all topics that could really, really impact a schedule in the final 20 days of the session. The state legislature has to end business by midnight on May 13th. Anything that isn't done by then, it's done. There is no opportunity to go to day 121. And then also looking at the state legislative update, we are expecting this, in addition to being a big election year for statewide offices, obviously every other year election, so the House is up and half of the Colorado State Senate is up. We're also expecting several ballot initiatives to come out. They're kind of in the title setting, the petition gathering. There's a lot of things in play, so there's a lot going on. We'll know by about September what makes it and what doesn't. But you're going to start seeing a lot of activity around that. And then on the federal side, fiscal year 2027 appropriations are getting started. For the budget that we look at closely, the HHS Education and Labor Bill, that is up in the Senate committee, or not House, the House Appropriations Subcommittees and Committees in mid-May. Right now, nothing that we are overly concerned about at this point in terms of massive cuts, but we are going to be keeping track of that. But that about mid-May is when we would expect, at least when it's scheduled for that one of those 12 appropriations bills to reach the appropriations markup and hearing stage. So that's pretty much it. Happy to answer any questions.
I have a question, Jared.
Ed?
That,
Yes, Ed.
Vulnerable adult financial exploitation banking, does the legislation talk about what will happen when the bank actually gets that? Will they contact Adult Protective Services, or what will they do? If they see that happening.
So right now, I know that was part of it. I'd have to get into those details on whether APS would get involved or not. But I know right now, because I hear the story a lot with like grocery store clerks, and so they can with gift card scams. And so someone is buying a lot of gift cards. They seem flush. I mean, they can tell when someone is not acting normally. They act like something is wrong, and there's a lot of times those grocery store clerks will even stop and say, "Hey, why are you buying this?" Like, and they'll explain, and the grocery store clerk will just say, "It's a scam. Like, if you don't do anything, nothing bad is going to happen." And sometimes it's just having that other person tell them, like, "Are you sure?" And they can kind of say, "Yeah, no, this is what's happening, and this is what is happening to you essentially." Banks don't have that same protection right now. So if I walk into the bank teller and say, "I want you to take all the money out of my personal savings and ship it over here," that's my money. That's something that if I want the bank to do that, they're really supposed to do that. And right now that gives the bank, especially that teller, to really see like, okay, I am sweating. I look like there's something going on here. I don't have a history of transactions overseas. I don't have a history of transactions of amounts that large. And they can put the pause right there, and they can just hold that transaction. Because the issue is once it's out, it's really hard to get them back. And so, whether they decide to refer to APS or someone else, but I think a lot of times, again, using the grocery store example, sometimes you just need someone who's like, "Listen, this doesn't smell right. This doesn't look right. Let's talk a little bit more about why you're making the transaction."
Yeah, I don't have a problem with the bill. I'm just wondering, it's fine to recognize that that might be going on, but the question is, what's the follow-up to that? You know, and that's the issue for me. I mean, will there actually be any follow-up? You know, banks, I mean, when they see a financial, when they see a questionable financial transaction with a company or anything like that, they have some things that they legally, that they have to do with, to let the federal government know. So I was just wondering, what are the things that a bank would have to do if they see something like this going on? So maybe you can follow up on that when you know a little bit more.
Yeah, definitely. And like I said, it's gone through both chambers. It is awaiting the governor's signature, so it's at tail end of the process right now.
But the bill doesn't necessarily have, resolutions in it that state what's going to happen if. Is that correct? It's just, it's the bill that says this is going to be part of the law, but the procedure for what happens next isn't part of the bill, correct?
So I'm reading it right now.
Yeah, Jared said he didn't know, and that would be my question. I mean,
You're not going to get an answer.
you know, what follow-up is, what, is there anything in the bill that states that?
That's the question. He's reading it now.
Yeah.
So I will say we have both DHS RAC members from El Paso County and Park County with their hands raised in person and online. They probably might be able to answer it between Susie and La Quinta. So whoever wants to go, Madam Chair, whoever you want to call on first, I should say.
Yeah, Susie. Susie,
Sorry, I'm really sick today. That's
Oh,
why I didn't come in
sorry.
person. Typically, banks will call us. I was just, as you know, I retired from the department, and for whatever reason, I'm not remembering if they're mandatory reporters, but I think they are. And I will verify that in just a sec.
Yes, ma'am.
They do call us.
Yes.
I actually am the manager over adult protective services right now. So we do get calls from banks. It's something a part of their process. That's still happening right now. So I don't think it's going to really have a change with the legislation. My team was at this last event that they had. So I could probably bring something back if there's anything that's included for us.
Great.
Once you're called, what do you do?
There's an assessment process where we have to take it to red team. We kind of look at it, try to see what happened. Really, a lot of individuals think that we can do things before it happens. There's not much that adult protective services can do before to prevent. But if there were some things going on and we find and we try to investigate, we can work with law enforcement to kind of work out what's going on.
And I think the answer to the question is you have a process.
We do. Yes, ma'am. Thank you.
Thank you.
Yes, and I did look up, banks are not always required, but often they have internal policies that cause them to report anyway because there is federal law to report suspicious activity. And so we find that we get lots of calls from banks actually, and I think that's great. Whether they call DHS or whether they call law enforcement, we hear about it because DHS and law enforcement report back to each other on these things. And then we, um, assuming it meets criteria for investigation, we will um, commence an investigation.
I guess the follow-up question is, and I don't know if you can answer this, Jared, but what about this law, what is different from the way things are being done today? How will tomorrow be different if it's enacted?
So I know a lot of the discussion, I heard a lot of discussion on the House side, but not as much on the Senate side. There was also much more discussion on the House side. It was really regarding the liability of the person who was holding the transaction. Because like I said, if it's my money, it's my checking account, it's I'm telling you to transfer $50,000, to someplace overseas. And if you hold it up, now I'm going to get really upset. Um, and this provides the opportunity. And as I said, the individual institution, if they decide that they go do this, have to report either to law enforcement or uh, adult protective services. It's not and, it's or, but as we've heard, they work closely together already. And it provides some timelines for how long the bank can hold that transaction while an investigation takes place. Right now, my understanding, and Susie and Lakita, please correct me if I'm wrong, is that there's a lot of federal stuff, but it's probably bank by bank in terms of what their processes look like. But this provides the opportunity for an institution, financial institution, to be able to hold it, how long they can hold it while an investigation takes place, just to see, is this, this might be a legitimate transaction. Things like this happen where all of a sudden you're transferring large amounts of money to different places. All of a sudden, there might be a legitimate reason for that. And the bank can still process it, but if you're showing kind of the signs of, like I said, you're stuttering a lot, you're nervous, you're concerned, like, hey, like I said, people can usually tell when something isn't going right. And this provides that bank teller to pump the brakes. It may be a real quick, maybe it's like, yes, there's a documentation, I got an invoice, or there's something that is good and they might release it. But this provides the opportunity, like I said, a lot of discussion on the House floor was about the liability for the banks and the bank's employees to be able to hold my request to send my money to this other account when there's warning signs going off.
Makes sense. Thank you. Any more
Yes,
discussion?
I'll just add that these cases got incredibly complicated. That I dealt with a situation in Park County with an individual over the age of 90 who was giving her money away, and we were tipped off by both the bank and a relative. And we looked into it actually a couple, 3 different times. And in fact, this woman's very much in her right mind, doesn't want to give her money to their living relatives, doesn't doesn't like the adults they became, and there was no reason, excuse me, to suggest that she may be incompetent. I've worked with Dr. Gibson on a couple of cases where we had some concerns about incompetency, not with this, particular woman. So the cases get really complicated and contentious for living relatives, understandably. But she wanted to send huge amounts of money overseas to someone she, believed she was in love with, and there was really nothing we could do to stop her. So they get complicated. But it's nice to know that the systems are generally triggered to look after these folks.
Thank you, Susie. Any further comment? Thank you, Jared. Okay, the chair having no report. Any further discussion items that have not been addressed? Seeing none. This meeting is adjourned at 11:19. Thank you all.